So this question is the ideal opportunity to show the interviewers that you understand the realities of what it's like to work within medicine, and you understand the important qualities that doctors need to illustrate. So again, similar to the previous questions, you can draw up an example table that has a list of the most common traits that doctors need to represent and what you have learned from your work experience, and then fill those in with specific examples. And you want to be mentioning those specific examples as evidence in your answer. So for example, we can go through things like teamwork, so any times that you saw that, any times good communication was mentioned, organization. So listing off examples where you saw those traits at work experience will be very useful. Also, when it comes to the practicalities of medicine and what it's actually like, you want to make sure that you're showing the interviewers you have a realistic expectation and you're not getting, say, a bright light syndrome. So it's not all roses. There are actual difficulties associated with the job, and common traits that come up with this can be the unsocial hours. Pay can be an issue that you mentioned in terms of practicalities. Any times that you ask the doctors that you were working with on your work experience, just try to illustrate how there may have been differences between the way that they worked and the way that you thought that they would have worked before you went and saw the work experience. So any sort of surprises, quite often people can be surprised by the amount of admin and sort of tedious tasks that doctors have to do. So we've attached a example document below with the kinds of features that you might want to represent in your answer. So an example answer could go as follows. I really enjoyed my work experience and it was a very good opportunity for me to see what it's like to actually work as a doctor. I think that there were lots of opportunities where I got to see doctors communicating with each other. So for example, one doctor would have to, if they were on call during the night and they were handing over to the day team, they would have to hand over and inform the other day team who were taking over the patient's responsibility for the patient's care. They would have to tell them about the key crucial elements of their current admission and what had been done with their treatment so far. The clear and concise communication that they used in that situation really showed me how reliant the job is upon that skill. I also saw how leadership is important. So the consultants who would be seeing the patients on the ward round in the morning would come up with a management plan. And one of the leadership skills that they showed was delegating their tasks to their juniors. So they would help the juniors decide what the tasks needed to be done first in terms of urgency. Quite often this centered around which patients were the most unwell, and the consultants would often help the junior doctors in deciding how best they could go about solving those problems and getting the plans that they had recommended enacted. I also got to see some of the constraints that working within medicine can provide those who do. So when talking to some of the junior doctors, they were mentioning how quite often their unsocial working hours can be a downside of the job. They will often have to work at nights and on weekends and do long shifts that quite often are irregular in their shift patterns. It was interesting having that conversation with those doctors, because while they were telling us how it's difficult to work those sporadic shift patterns that can be unsocial, they were also saying it was very rewarding to be that initial person providing that care to patients who became unwell, whether they were patients who were coming through the door or whether they were patients who were already admitted and had some sort of medical problem occur while they were on the ward. And as a last bit, this can be a very good time to mention your awareness of the MDT, which stands for the multidisciplinary team. So this includes all of the team members that contribute towards making a hospital function. So the doctors, the nurses, the physiotherapists, the pharmacists. So you can also use this as an opportunity to show your awareness of that and touch on what the roles and responsibilities of each of those team members might be and how they are all needed to make the hospital function as a whole. Just showing an awareness of this just illustrates that you picked up the way that the hospital works while on your work experience.